today I'm going to be teaching y'all how to do a closed Foley catheter continuous system. So the first thing you want to do before going into the patient's room is you want to check the physician order to match the MA. And then we'll be done. My name is Brianna. I'm going to be your nurse today. Can you tell me what your name and your date of birth is? Okay, Ms. Hernandez, today we're going to be irrigating your Foley catheter. So with irrigating a Foley catheter, it's a lot of times indicated for post-operative genitourinary procedures. You want to make sure you assess for a bladder distension. You want to check for blood clots in the tubing and in the bag. You want to check for sedimentation. You want to check for I's and O's. You want to see if there's a decreased amount of urinary output. And if those are indicated, you need to notify the doctor, and this is what we're going to do to resolve that problem. So the supplies that we need today are going to be your antiseptic swabs, your gloves, your tubing, and the irrigation solution, and then we're going to have an IV pole over here. Okay, so the first thing I want to do is make sure my clamp is rolled all the way down. If it's not, then the fluid can easily leak out. So I'm just going to remove my cap from here and from the bag and spike it. And once you know that it's secure, you're going to get your IV pole. So now I'm going to grab it on the IV pole, and I'm going to squeeze the chamber right here so it gets some fluid. I'm going to squeeze it about halfway. Okay, so now you want to prime your tubing. You don't want to have any air bubbles in this swab before we connect it.
Because I have to drive like 30 minutes. Oh, do you live in Portland? So, okay.
And I already have my trash can set up.
No, this is downtown. I live center by the mall. Yeah. Drive back to our facility. And we literally set up College Street. College Street, there's
10 hours?
10 hours straight. 7 to 5.
So, I mean, I'm doing 12 to 11.
Okay, so we've primed our tubing, and we're just going to put this cap back on it.
And I'll be like, okay, well.
And we're going to get everything set up for the patient, and then we'll just go ahead and hang this up here in the meantime. So now that I have my IV tubing set up, we're going to go ahead and expose this area. And at this point, I would probably remove my gloves and wash my hands just so we maintain as much aseptic technique as we can. So we're going to remove the catheter from the securement device. You want to make sure it doesn't pull on the patient. It can cause discomfort. It can cause it to dislodge, so we want to make sure it's not moving. I'm going to take my alcohol pad and I'm going to clean this area.
Urine collection, thank you.
So this is it. And this is from the mouth.
And I would do it 10 to 20 seconds.
I'll be like, okay, I'm about to get into your nurse now. I feel uncomfortable. Alright, can you blow your nose?
So I'm just
Breathe in.
going to say,
Fill out.
and we're going to
Breathe in, fill
perform.
out. Which one do you feel the most pain?
Or you can
Okay, so I can be able to assess it. I'll how to see it and that.
Yeah.
Are you doing
Yeah,
okay?
wound care before you put it in.
No, we already.
Okay, so now we're going to reattach our device. And we want to make sure it's not tangled up with each other, which it's not.
Okay.
And we're going to go ahead and set our drip rate per physician's order.
Wound care, appropriate. Wound care. Wound care has
Okay.
performed according to hospital.
And that is all you have to do for the continuous irrigation.
Hi, my name is Keena Hunter, and today we are going to do a intermittent catheter irrigation. Okay, so we have our prospect, Miss Mary Hernandez, and we're going to get started on our irrigation today. Okay. So we're going to wash our hands like a good nurse should. Okay, and then we're going to introduce ourselves to the patient, getting two patient identifiers, of course. Okay, and then we're going to get the bed to a nice working height. Okay. So before we do anything, it is best to wash our hands and put on gloves. And we would just inspect the catheter to make sure that it's not any leakage, that it's properly inserted into the patient, of course. We're also checking the bag, the drainage bag, for any clots, because that could be a huge concern. Okay. And just patency of the catheter. Okay. So now we have our supplies. We have our syringe. It should be 35 to 50 milliliters of the solution into the catheter. We have our cup to draw it out of the syringe. Tape. A clamp with a rubber band is important. Alcohol pads for cleaning as a cleaning solution, and any extra alcohol pads, you never have too much. Alrighty, let's get started. So we have our bag. We were going to clamp this off to the patient, and we're also going to use our clamp and rubber band to clamp off the catheter bag. Okay?
So, I'm going into your nose, okay? This one's
Now, make sure you work out, because this can be really hard if you haven't worked out in a while.
Name it, time, verify with the patient, make sure that
Okay, pause. Okay, so we removed the securement device from the three-way catheter, and also we've clamped our catheter bag and also our solution for irrigation. Okay, so now I would change my gloves and wash my hands, of course, and so get my solution ready, which is already drawn up from my syringe. Again, it should be needleless. Okay, and also have my alcohol preps ready to go. Okay, so I'm going to clean my third port, and also I'm going to get another alcohol prep and clean my needleless syringe. Okay, and both are clamped, so double check that. All right, Miss Mary, I'm going to inject the syringe, and this is to prevent any clots or blood clots, and this is aseptic technique. Okay, so I'm going to draw my syringe. 35 to 50 milliliters. Okay, now you would just unattach the port of the syringe, and then you would secure it back to the securement device, like so, and then unclamp the bagging for the irrigation solution, and you will also unclamp the catheter bag as well. Okay?
What do you want from her?
Well, show him the paper. Don't anything, because he has to do it.
Clear as dirt. So now it's secure, and also you would just watch for any blood clots or any irritation for the patient. As the patient, if they are in pain, monitor the I's and O's for the input and output, and you would lower the bed, lock the wheels, and make sure both side rails are up, and wash your hands.